As COVID cases surge across the world, India is gearing up to fight against the virus. The Prime Minister today chaired a crucial meeting with his ministers and top officials to review the COVID situation here in India. In the meeting, the Prime Minister has cautioned against complacency and laid emphasis on the need for strengthening surveillance with a focus on genome sequencing and increased testing. The Prime Minister has also advised that there is a need to maintain strict vigil and states must ensure operational readiness of hospitals and infrastructure. States have also rolled out their combat plans with the mask mandate partly returning in India, though limited to one state, that's Karnataka so far, with some conditions. So is India battle ready? Tonight on the Newshour, we're joined by India's top health experts. Let's first and foremost go across to Dr. Naresh Trehan, who's in fact going to be joining us in just a few seconds and in fact get a sense on what these protocols should be. At this point of time, there is a lot of grey area. While the government has certainly said that restrictions have to come in, it perhaps is still missing in black and white. Let's go across to Dr. Trehan now, Chairman and MD of the Medanta Group. Dr. Trehan, thank you so much for joining us this evening. First and foremost, as we were just debating in the previous debate, there's some amount of grey areas. There are congregations happening. It doesn't matter if they're religious, political, social, cultural, so on and so forth. We all know that it is big events like that that have been super spreaders in the past. Now, while the IMA may have come out and issued appeals on masking and social distancing, there's no government protocol yet on that, and that perhaps is causing some amount of confusion. Do you think the time is right for the government to quickly issue those protocols and end whatever grey areas there may be?
So, if you look at it, government has to act responsibly on data that becomes evident. Today, we know that there is a fire burning in China, that is like the numbers are just devastatingly high. We know that some of it. So if you look at the fact that how vulnerable is India now, given the background, is yet to be seen. So today there have been, like maybe more cases will come up, but 4 cases that were detected in India with BF7 have all recovered. It's not so virulent as far as that is concerned. And historically, if you look at the behavior pattern of viruses, that every time they mutate, they become more infective, but less virulent. Means they don't.
Yes, I was coming to that point exactly.
As otherwise. So that's why that all these differentiators have to be kept in mind before we say that we panic and say shut down everything or lock down or everybody goes this way.
Absolutely.
But having said all that, let me just put it in perspective of what I believe or what we believe in the scientific community, how we should progress further. So on one hand, you have 3 things that we have to look at. One is, what is the actual situation outside and measure it against what I just talked about. The second is, what should the government do? And the third is what an individual should do as a society. So what the government is doing today is saying, look, wherever there is detection of any positivity of COVID, do genome sequencing to know what variant are we getting affected with.
Yes.
Second, because in our Delta wave and also subsequent to that, and I was participating in it because I was also named a member of the Supreme Court committee to just monitor this whole situation and give suggestions, that we have a very real early sensor information system in place. So we are saying if at any block level there is an outbreak, it is reported real time into the Central Health Ministry Command Center. So if we are monitoring India in that intensity, we are hoping that an outbreak will not take place and we will take graded measures to be able to protect the population.
Right. Dr.
As an individual today, from the facts that we have, I believe that we should avoid going to crowded places. If we have to go, wear a mask. If you are traveling in an aircraft, I think you should wear a mask. If you are going to a movie hall, in a theatre, you should be going where you will be parked for 2 hours with hundreds of people in there, wear a mask. So we are not at a stage today where we say there is panic or we should shut down anything. I think we should be responsible because we've always talked about life and livelihood and we must keep the balance going.
Absolutely.
So,
But sir, one important point that I want to come to you on, and this is one area where a lot of concern has been expressed, and that is when it comes to the boosters. While the government may have said, and perhaps rightly so, that it has set records in terms of total vaccination, the fact is that a large proportion of our population has still not received the booster. And do you think that perhaps is an area that requires a refocus or redoubling of efforts, at least on part of the government?
so I'll tell you the background on that. That booster is available. It's not like it's not available. So they are supposedly quote unquote effective against not only the previous virus but some of the mutations also.
Right.
So what can India do as far as that is concerned? We should also, like every year, the flu vaccine is tweaked to beat the challenge of the new virus. Similarly, we may have to do it for COVID also. So I think today, elderly people and people with comorbidities should get a booster.
Right.
They should also wear a mask. Now we have three situations playing on us right now. This is the flu season. Also, the air quality is devastatingly bad in North India. And third, there is this overhanging fear of COVID coming back. So if you have a cough and a cold, mask yourself and isolate for the first 4 to 5 days so that you don't infect your immediate environment,
right,
your families or your workplace. You don't need to do more than that right now.
Right.
The second thing is that if you must get yourself tested, you can do a self-test, at-home test that is available at a reasonable price. And if that is positive, of course, you should get an RT-PCR because then the genome sequencing can be done on it and
Absolutely.
we will have an idea of what we are dealing with.
There's a lot of concern also. Dr. Trehan, a lot of people have concern about children as well because, you know, we've seen that there are vaccines out there, you know, in terms of the actual coverage of children being vaccinated because very small children, as you all know, cannot be. What is the latest advice on that one and where would you stand in terms of advising parents on how they should go ahead in the wake of this fresh threat?
So, you know, we chose a lot of children did get vaccinated and some of them may not have been vaccinated, but their immunity will be dependent on whether they got the vaccine, one or the 2 doses, whether they got COVID at somewhere along the line so that they have developed some natural immunity. And I think that there is one of the few things that is on the anvil is the fact that how effective is the nasal vaccine? Is it because it is not being used in very large numbers to be able to say whether it's protective or not, but it's a very convenient way of doing it.
Okay.
And if the preliminary studies show that it is effective, but the real post-market study or what we call phase 4 of any trial is still to come. That proof is still to come.
All right.
So I think that there are many things happening, moving parts are, but we should put it together on a regular basis on the information that comes through. So we should neither be foolhardy and say, oh, COVID, we'll deal with it or we don't care. No. But on the other hand, don't panic and run helter-skelter.
Let's not over-panic as well. Thank you so much, Dr. Trehan, for joining us and sharing with us your perspective. We're also joined by 2 other doctors on our panel. We have with us Dr. N.K. Mehra, who is, in fact, the former Dean of AIIMS. Also with us is Dr. R.R. Gangakhedkar, who's the former head of the Division of Epidemiology and Communicable Diseases. Thank you so much, doctors, for joining us. But we have our viewers joining us, and we're going to pose some questions from them. Kush is our first viewer joining us from Bengaluru. Yes, Kush, your question for the doctors.
Question is that those who already had COVID and still suffering from after effects, how susceptible they are to COVID again?
Okay. Dr. Gangakhedkar, would you like to take that question? Dr. Gangakhedkar, can you hear me, sir?
Can you repeat the question?
Yeah, the question from the viewers, those who already have had, after effects of COVID, how susceptible are they to this new variant is the question, if I got it right.
If I understood it correctly, people have got infection and how susceptible they are to acquire the infection now.
Those who have
New
after
variant.
effects of COVID, yes.
Yes. Now, one of the things which we have to remember is no matter what, the vaccines have lower efficacy in preventing new infection. Even the virus, when it mutates, it tries to overcome the immune protection that is generated even by infection itself. So essentially the variant that comes out is an escape mutant against the antibodies that have been generated by vaccine as well as those by the infection itself, natural infection itself. So it is going to have, it is likely to pose challenges in terms of preventing the infection. But that doesn't mean vaccines don't prevent infection at all. They
Right.
prevent it at a lesser protective level compared to what it protects against hospitalization as well as the risk of death per se. And that is the main reason why we are keeping on saying, please continue to take the precautionary dose, because that would be useful not only in protecting you from hospitalization and death, but
Right.
also to some extent against getting new infection. Right? New infections can happen even if you have hybrid immunity.
All right, Dr. Mehra, your views on this?
Yes, of course. I think those who have had infection in the past, and if they're vaccinated, they would have the hybrid immunity. Those are the people who are really covered extremely well. But of course, there are other factors as well. If you have underlying, diseases like diabetes or other autoimmune diseases, there you can have the breakthrough infection as well. But by and large, I think the population of India has done very well. You saw that in the Delta wave, you saw that in the Omicron wave. This year, from January to March, the number of people who got infected with Omicron was very high. This is not the case in China. The problem in China is very different from India. India has done very well. China, on the other hand, with a flawed policy of zero.
Dr. Mehra, if I can just ask you to hold on to your thoughts. Another viewer joining us, Anand from Mumbai. Yes, Anand.
Good evening, doctors. My question is, I have had both the vaccines, the two vaccines initially, and I was almost all set to go in for the booster dose when in the interim I had a brush with the Omicron variant. After which some of the doctors told me that Omicron is a natural booster and you now need to go for the booster vaccine. So how true is that? That
Dr.
is number
Mehra.
one. And the second one is, and the second question is, now for the new variant or whatever that we see coming, is there a new vaccine that somebody needs to take, and where will this end?
Okay, new variant, new vaccine. And does a person who has Omicron, does he have a natural booster? Dr. Mehra.
Well, that has been a faulty belief, actually. I have had 2 vaccine doses. Now I've got the Omicron infection. Now I don't need to take new booster. And that is why you saw that the number of people in India who have taken the booster dose is still very, very low. It's about only 1/3 of the eligible group, actually. But I think our focus now should be on those only, whether or not you had Omicron infection or not. Let that infection be there, but the booster dose is a must.
All right, we'll have to leave it there. Dr. Ganga Khedkar and Dr. Mehra, I'd like to thank both of you for joining us. Certainly a lot of questions that our viewers have, a lot that our doctors perhaps have answered, but certainly with, in fact, the government coming out and sounding the alarm, or at least asking for protocols to come out into place, certainly a lot of concern also that, and a lot of responsibility also on citizens. It's not just the government, citizens too will have to ensure that masking, social distancing, they're all prevention that can actually be put in place by their own responsible activities at the end of the day should be there to ensure the safety of all. Thank you so much, gentlemen and doctors, for joining us this evening.
The news